Now, basically, oral health is not isolated from the rest of the body. Your mouth, your head are all connected to the rest of the body, so there are many conditions which affect a person's general health also have quite marked effects on their oral health, and some vice versa. And that doesn't include the really obvious things like people with eating disorders who are purging all the time and bathing their teeth in hydrochloric acid. That obviously wrecks their teeth. But some other things that may not be so obvious, diabetes. People with both insulin-dependent and non-insulin-dependent diabetes are at markedly increased risk of periodontal disease, which is the condition that affects the bone and the gums and the bone supporting the teeth. So it may not affect the teeth itself, but if your bones aren't healthy and the teeth get loose, you can still get abscesses and infections and lose teeth that way. Periodontal disease is likely to progress more rapidly and may be more resistant to therapy in people with diabetes. And it's worse if the control of the diabetes is worse. So it's due to the fact of the effects on the immune system. Basically, any condition that affects the immune system will have effects on periodontal disease to the detriment of the oral health. There's also evidence that treating periodontal disease may actually help control the diabetes because you're decreasing the number of harmful bacteria in the mouth, which will therefore decrease the number of these harmful bacteria and their toxins that get into the bloodstream, so it can help general health that way. Something a bit similar with cardiovascular disease. Periodontal disease may also be more severe in people with severe cardiovascular disease, and that's due to poor circulation in the tiny little blood vessels that the mouth is full of. So if they get constricted due to plaques, the plaques in the blood vessel, you don't get as much circulation and it affects the body's reaction adversely. And once again, it also will help if the periodontal disease is treated, and that's basically by regular cleaning and encouraging the person to do their own maintenance, and that can help by decreasing the circulating toxins as well. Dry mouth is a really big one in sort of the clientele we see, and most people here except perhaps some paediatric workers. Saliva is really important to oral health. It acts as a lubricant. If you have poor saliva flow, people with severely diminished saliva flow, people can actually have difficulty swallowing, eating, because you can't make the bowels to swallow. It also lubricates the dentures, so people with a very dry mouth often have more problems with their dentures. They don't get as much retention because adhesion relies on the moisture. And the dentures don't glide, they will just rub and get more ulcers. So they also experience very high very high decay rates with poor saliva flow because the acid hangs around in the mouth, and the sort of bacteria that live in the mouth tend to be ones who like acid, and they're the bacteria that cause tooth decay. Very likely to have more sensitive teeth because once again the acid hangs around and it can cause erosion of the teeth and also the tooth structure even without decay. Painful or burning oral mucous membranes, so basically everything is dry and gets raw, and you sometimes see people whose tongues are shiny and red rather than bumpy. And as I said before, difficulty swallowing. Now the causes of dry mouth are variable. But probably the most common one that we see is polypharmacy. People who are taking more than 3 medications are very likely to have dry mouth. Even if an individual medication doesn't cause reduced saliva flow, the combination of multiple medications tends to have a sort of a synergistic effect, and they tend to have a much higher risk of dry mouth. And people don't necessarily realise, some studies have shown that people don't realise they have a dry mouth unless their saliva flow has diminished more than 50%. So they may not be aware, or that when you ask them they say, oh, yes, I do have to carry a bottle of water around with me, or this isn't the same as people who mouth breathe at night, that you wake up in the morning with the morning mouth. That's often due to blocked sinuses and things, but it's like that all the time. Other things, alcohol, caffeine, nicotine and all opiates have marked effects on the salivary glands, and along with many prescribed drugs, some high blood pressure medications, many antidepressants, antipsychotics, antihistamines, a whole lot of things. And hepatitis C infection and some other liver diseases also worsen dry mouth. So there's a whole lot of things if someone is in any of those categories. There are things you can do, and one of just something that you can, if someone does raise that with you, is if they've got teeth, enough teeth to chew, is chewing sugar-free chewing gum for 3 times a day, about 10 minutes each time after eating or snacking. That actually, if they've got salivary glands that work at all, that will stimulate those salivary glands. And stimulated saliva is higher in calcium than unstimulated saliva, so that can help counteract some of the effects of the acid in the mouth. There are other things, there are lubricants and mouthwashes that are available over the counter that if, you've got information about that. Okay, smoking. We're having a whole session about smoking, but as far as oral health, smoking does, similarly to diabetes, a person with diabetes who smokes is likely to have rather bad periodontal disease. It affects the circulation, it makes the periodontal diseases more likely to be worse and more resistant to treatment. And however, because the circulation is affected, the gums may not bleed as readily and people may not recognise that they've got a problem. Smoking also affects the salivary glands and is a common factor in dry mouth due to the nicotine. Oral cancer, it's a yuck thing, and we don't like to think about it. 4 people a day are diagnosed with oral cancer in Australia, and it's about a 50% survival rate after 5 years, so it's got a very high morbidity rate, usually because it's diagnosed quite late. It's the risk factor, mostly males, and the main risk factors are age, smoking and alcohol use. However, with more women smoking and drinking and reaching, as they get older, that pattern may change. But it's, the people who live in rooming houses, various other lifestyle problems are probably at very high risk of oral cancer. Unfortunately, we're finding, it seems that the age rates of oral cancer are getting lower, and there seems to be some link to human papillomavirus, so increasing oral sex may be causing oral cancer to be seen in younger people, particularly younger females. Substance abuse and associated lifestyle, often poor nutrition, poor oral care. You've got dry mouth due to the opiates used. Things like amphetamines not only cause dry mouth, they also cause people to be clenching and grinding their teeth a lot, so they tend to wear teeth more, they split teeth more. And particularly with alcohol and cigarettes involved, there's increased risk of oral cancer. Osteoporosis, I want to mention that because the use of bisphosphonate seems to be going through the roof now. They're readily available under the pharmaceutical benefits scheme. Bisphosphonates are used to prevent bone fractures in people with osteoporosis, but they also increase the risk of what's charmingly called bronch or bisphosphonate-related osteonecrosis of the jaw. In people who are on bisphosphonates intravenously for bone tumours and secondary tumours in the bone or multiple myeloma, things like that, they have quite a relatively high risk of this bronch. But even people who are on oral bisphosphonates for osteoporosis, that's things like Fosamax and Actinol, where they take these drugs once a week. If they have to have a tooth extracted, it's a very small risk, but it's not a zero risk. It's less than 0.5% for a simple extraction, but if it occurs, the socket just doesn't heal and there's no effective treatment. So it's something that if you see someone who's on bisphosphonates, please encourage them to have a dental check, because keeping their teeth healthy is really important. Okay, other cancers, basically anyone who's about to have chemotherapy, you want to get their mouth as healthy as possible before they start the chemo, because no dentist will want to be doing anything to them when their immune system is wiped out by the chemotherapy. So that's just something we do occasionally get people in pain. But the other thing with chemotherapy is that their gums get really, really tender and their mouth is very, very dry, so dry mouth and all those factors are involved. And other orofacial pain, not all pain in the mouth and the jaw region is caused by teeth. Very common, there are a whole lot of other factors. The most common one is probably we call it TMD, temporomandibular disorder, which is sometimes known as jaw joint pain, but the pain is mostly not from the jaws, it's from the muscles around the jaws. So although they might hear a clicking in the jaw, the pain is often from the muscles surrounding the jaws, which can include headaches, temporal headaches, shooting pains in the ear, just tight, sore jaws. Often, people wake up in the morning and they feel as though they've gone a few rounds with someone overnight. Neck pain, pain around under the jawline. There's a whole lot of things there. Treatment is variable and often can include an occlusal splint, and sometimes people can get relief just buying an over-the-counter mouth guard, which is quite simple and cheap. But also should include massage, relaxation. It can include various drugs, physio, but basically often explanation and reassurance can actually help. They know they're not going mad, but there's nothing terribly wrong. So there's a whole lot of things there. Okay, pregnancy, it can cause, the main cause of pregnancy is that it increases gingivitis, because the hormones actually make the gums bleed more regularly, and there are a number of you can actually get little lumps in the gums that look like little abscesses that are actually hormonal. The blood vessels proliferate and you get the little lumps, particularly between the teeth. They resolve very shortly after the baby is born, but a really good idea for women to have their teeth sorted out before they become pregnant, ideally. Dental treatment is safe during pregnancy. We avoid unnecessary radiographs, but the dosages for dental radiographs are very low, so it's not unsafe. And normal dental treatment is safe during pregnancy. The local anaesthetics had been classified as safe for dentistry, but we prefer not to see people in their last trimester because they're very uncomfortable lying back. And if someone is really stressed and tense, we don't want to be stimulating